Good morning, good afternoon, good evening, wherever you may be. Welcome to OET Medical Online Grammar Series videos. In today's video, we're going to go over some of the aspects of what is known as the passive voice, how to understand it and how to use it. So here's a quick diagram of basically what the active and passive is. But I will be discussing that and giving you many examples in this video. So a frequently used grammar aspect of the writing exam is the use of the passive voice. In this video, we will look at various aspects of it and how it can be used in different forms. The first thing is the why. Why do we use this form of grammar in the letter? There are three main reasons. First, to take away the focus from the person or thing doing the action. Second, when we don't know or when it is not important who does the action. And three, we can also use it when we're giving out general guidelines or instructions. Okay, just to provide a couple of examples of these meanings for the sentences above, these three sentences, we think of the medical environment. The most important thing is the patient. So sentences should be centered around the patient. Example, the patient was given treatment, medicine, whatever they were given. The patient is the subject, so the focus is on the patient. Another one is that we sometimes do not know who performed an action, and it is often not important. So therefore, we focus on who receives the action. The new ICU unit was opened last year. The ICU unit is the subject. In both of these sentences, we ask ourselves, who gives the medicine or treatment to the patient? Usually, it's not important who does it. When we need to say who does it, we use an active sentence. So, example, an active sentence. Nurse Jones gave the patient her injection. So, Nurse Jones is doing the action, giving the injection to the patient. So, that's an active sentence. And also, do we know who did the action, or is it important? Who opened the ICU unit? Maybe an important dignitary. A dignitary is a important person. That's an expression. Someone with an important job or position, like a mayor of a town, a president, or chairman, or something like that. So maybe it was an important dignitary who performed the action of opening the unit. We don't know who exactly it is, and is it important to us? The answer is probably no. If you're a medical professional, you don't care who opened the ICU. You're interested in, does it work? Does it have the equipment I need? Is it good for patients? That's what you're interested in, not who opened it. But as I've made a note here, in some countries, the answer may be yes, because social status and many other cultural things. So, but from in the UK, where I'm from, that's less important who opened it. Again, if we want to express who did the action, we make an active sentence. The mayor opened the new ICU unit last year. So the mayor, action to the ICU unit, active. Another use is providing information, instruction, advice for general consumption. Basically, these instructions or information mean to you, to everyone, or to all people. Nothing should be eaten for 3 hours prior to operations. That means do not eat anything for 3 hours before your operation. That's an active sentence. But when we're generalizing, instead of saying to you, you must not do this, you must, it sounds not strange, but we don't need to include you. And the best way to remove the subject of you is to make it passive. Jewelry is not to be worn in the theatre, or in theatre, sorry. Do not wear jewelry in the theatre. If you're a staff member and you're in theatre, you can't wear jewelry. So that's a general message to everyone. All medicine must be taken at the time. Oh, that should say it is dispensed. Medicine is uncountable, so it should say it. I thought I checked this, but obviously I didn't check it enough. But that should say it. So please take your medicine at the time we give it to you. So you can't get the medicine from whoever dishes it out, whether it's a nurse or orderly, whoever, and keep it to take it later. No, you must take it when they give it to you. So as you can see, it's much easier to say it in a passive form than it is in an active form. These terms are less used, but they're useful to know if you need to write a guideline or something in your letter. If you're given a letter with information, you may possibly need to use this. Okay, now the structure. Two things are needed for a sentence to be passive. These are the verb to be and the past participle. The main confusion with students is when you say to them the verb to be, their only thought is the variants am, is, are. While these are the main variants, we also know that they differ according to the tense used. The passive is in most tenses, not all tenses, but it's in most tenses. So depending on the tense we use, we have to adjust it to create the correct form. So we can use present continuous, is being. I haven't put the past participles in here, but I'll give you examples as I go through them. Is being, are being. The patient is being transferred to another ward. The people are being attended to. So the past participle will go there. Past simple, the patient was seen by the doctor. The patients were seen by the doctor. So plural single. Past continuous, the patient was being treated for whatever. Or the people were being attended to by. So we're adapting. We just don't have the past participles here. Present perfect simple, has been. The patient has been taking paracetamol. The patients have been taking paracetamol. So these are just plural single. Past perfect simple. Before he was admitted to hospital, he had been seeing his GP on a regular basis. No, that's not a good example, sorry. I'll give you another example. That was just me thinking, but I have another example. So we also use the future. Will be, is going to be, needs to be. These things indicate the future. The patient will be transferred to another ward next week. The patient is going to be transferred to another ward. So we have, yes, be plus past participle. Here we use this be plus past participle. Needs to be transferred, is going to be transferred. So these are examples of the future, what's going to happen. So the underlying pattern is the verb to be must be present in one form or another. You have lots of different ways that you can express the verb be but it must be in there along with the past participle. For the exams, the examples provided here will be more than enough for you to cover all scenarios. Now we can look at the other component, the past participle. There are two past participles in grammar, the present participle and the past participle. The present participle is the ing form. Example, eating, sleeping, taking, etc. Used to make continuous tenses. He is eating, he is sleeping, they are taking. The verb here is. The present participle is taking. That's the pure grammar form. And we use it for adjectives. Again, I've given you an example, same form with ing, but they can be used as adjectives. Fascinating, interesting, boring. We call them adjectives, but the actual formation is a present participle. They have different functions, but the spelling is the same. And the most important one for you for passive is the past participle, which has different forms. Most common ones are ed, which are regular, and en, ridden, taken, eaten, spoken. Those kinds of past participles are very common, but there are many different ways to express it. So in the description below this video, there will be a link to a past participle chart for you to look at different past participles, as well as an exercise that shows you past participles. Okay, past participles are used for perfect tenses, passive tenses, and adjectives. I have eaten lunch. That's present perfect. It has been eaten, or lunch has been eaten. A half-eaten sandwich. So half-eaten describes a sandwich. We've only eaten half of it, so we can say half-eaten. So this is a this is a past participle, past participle, past participle. So don't be fooled into thinking that you can only use the past participle for one thing. This is what catches out a lot of students. You think the past participle is only used for one thing. No, it's used for a variety of things. Here are some simple examples. But here, you're only interested in this for the letter. You'll use them in different situations, but we're looking at today at this, the passive. So the past participle is what you need to complete the passive structure. So we have the verb to be in its different forms, and we also have the past participle. We use each voice depending on the time frame, past, present, future, and the tense, simple or continuous. So now I'm going to just run you through some examples for different tenses. In the present time, present time is usually present continuous more than present simple. Mr. Jones is being treated for osteoarthritis. Now, the patient is being transferred to the ICU. Now, an IV is being administered until the patient's fluid levels increase. So this is happening now. If it's happening now, we generally use continuous. So being is our continuous form, treated past participle. So this follows the rules. The verb to be, past participle. Verb to be, past participle, etc. Present simple. Oh, that should say patient. The patient is often seen at his local hospital instead of at his local GP. So, to be, past participle. Mrs. Davis is known to have an ongoing issue with angina. Verb to be, past participle. If you turn this into an active sentence, we would say, we know that Mrs. Davis has an ongoing angina. So to make it passive, Mrs. Davis is known to have. Tom is said to be suffering from gout. So is said to be, who said it? Is said to be by someone, but we don't know who said it. So again, verb to be, past participle. Past continuous examples. Last year, the patient was being treated for the after effects of a myocardial infarction. While Mr. McDonald was being discharged, he suffered a relapse and had to be readmitted. He was kept in hospital and was being observed by a specialist. Present perfect simple examples. Sarah Johnson has been operated on to fix a clotting issue. The patient has been seen by several different doctors. Miss Martin has been sent to the ward for her recovery. Who's doing these things? We don't know. We don't care. It's not important. If it's important, we make the sentences active. Past perfect simple. Now remember, for past perfect, there must be two actions. Usually, past simple, past perfect, they go together. First sentence. Oh, that one's wrong, actually. I didn't check it. I'm a little bit annoyed with myself because I didn't check that. It should be had been seen by his doctor. Before he went on vacation, Mr. Osborne had been seen by his doctor about this issue. I will change that. So please stop the video, listen to it again. This should read, had been seen by his doctor. He had been pain-free before the latest episode of his thrombosis. So here, this one, you could say, this is the past simple, past perfect, past perfect, past simple, before the latest episode. It's not exactly past simple, but it implies past simple. Before this happened, this had been happening. Now we have future simple examples. Sometimes you need to indicate future actions. Next week, the patient will be visited at home by a district nurse. Another thing which I'll mention now as an after point, if we know who's doing the action, but the focus is on the patient here, we can put who's doing it using an agent. This agent we call by a someone. It's still a passive sentence, but here we know who's doing it. The only difference is we're shifting the focus. We want to keep the focus on the patient, so we follow the passive, and if we know who's doing it, we put that at the end. So the next week, the patient will be visited at home by a district nurse. After Mr. Bates' discharge, he will be given a weekly session of physiotherapy. Who's giving it to him? We don't know, but he will be given one. It is yet to be decided what will happen regarding the patient's future treatment. Who's deciding it? We don't know. So it is yet to be decided. What it means is we haven't decided yet on what will happen. That's an active version. Okay, so there is a worksheet with multiple examples and an exercise in the link below. There is also a verb chart which indicates the past participle. The rule of thumb when writing the letter is that it should have at least 60% of it in passive. I'm not sure if that is actually correct. I got that information, I checked that information. I'm not sure, so please check yourself. I don't think it's that high. I think it's probably below 50%, but the information I checked says this, but I was not sure, so I've put it in there, and I'm also explaining it to you now. So don't take that as 100% correct. Check it out yourself. So this is because passive should be in your letter very prominently because of the nature of the letter. The focus is on the patient. So that's why we use the passive a lot more than in normal or other letters. This is because the focus of the letter is the patient, not the people who treated the patient. So we should not refer to who did something unless it is vital to the situation. And finally, the main thing to remember is if it does not have both the verb to be and the past participle, then it is not a passive structure. Here is a Google link. I've just put it there, but I will put it in the description afterwards. I put it there as a reminder to myself to make sure that I put it in the description link. So now I can't forget. So this is the end of the lesson. Again, there will be more grammar videos coming up. If you would like to have classes with either myself or my colleague, Philip, we're both native teachers from the UK, hence oetmedical.co.uk. You can visit our website. There's lots of material. There's also an assessment page, so with some tests where you can assess yourself. If you go into the website and look for OET preparations, there are just some tests to evaluate you. There's reading, writing, speaking, and listening. It's a free evaluation. The reading and the listening, you will get the results immediately. The speaking and the writing, you have to submit them to us and we will reply with an assessment for you. The service is free, but the classes are not free. So if you would like to book classes with us, we have a different range. We have single classes, 5 class packages, 10 class packages, and 20 class packages. Obviously, the more classes you book, the cheaper it is per class. So please subscribe to the channel if this is the first time you've visited our channel. Please comment and like, and also hit the notification bell when you subscribe. So when a video is published, you will be notified immediately. So thank you for your time and see you in the next video.